Hi friends, in this video we'll learn how to do or how a root canal procedure is done. Here you can see teeth being reconstructed badly, caries tooth being reconstructed using the root canal treatment. So I'll be explaining step by step. Initially what they do is they give local anesthesia to the gums to prevent any discomfort which you might experience while drilling the teeth. Now using a driller, tooth decay is cleaned using the driller. You can see the decayed teeth being cleaned using a driller, and all the rotten part of your teeth is removed using this driller. And you can see the damaged portion being drilled out, and you can see now the normal teeth has started resurfacing. It's being dried using the air blower. Now probe is used to see whether there are any leftover crevices. Those are the portions where infection lingers or gets left over. Now you can see that part is being cleared using drill. Now this is the tooth which is the root which is decayed. You can see inside how bad it is. Now the entrance to the teeth is drilled using another drilling head, and a rubber dam is applied to prevent any spillage of or touching the other parts. Now the root canal treatment starts, and initially a needle probe is put to see the depth of your root. Now one more driller is used to extract the pulp from the root. Now the root canal is being cleaned using the driller, and a proper shape is given. You can see a water is used to flush out the drilled material. Now the root looks completely clear and healthy, and it's time to do the root canal treatment. And the root canal is treated with antiseptic to prevent any further spread of infection or to clear the infection which is in the root. Now the next step is to use gutta percha to fill the canal. Now you can see the canal being filled using the gutta percha. Now that leftover portions is removed to prevent any discomfort to the patient. The gutta percha is properly placed now, and you can see the clean tooth with the roots. Now composite resin is used to fill up the cleaned tooth. Now you can see the root getting filled up using the composite resin. So it's of same color as the teeth, and it gets dried using the ultraviolet rays. It is hardened using the ultraviolet rays. Now ultrasonic cleaning of the teeth which is adjacent to the gums is done to remove any scales which are present on the teeth. And now one more time the drilling is done to clean the surfaces, and canal is done on the lateral portion of the teeth so as to allow the composite resin to fix properly. Now acid etching is done to remove any leftover debris, and the acid etching is done. After that it's being cleaned. Now the adhesion is applied so as to help the composite resin to fix properly to the teeth. Then the filling starts step by step. Now the filling is done with the composite resin. You can see it is whitish in color, and it matches the color of your teeth. Gradually, step by step, the composite resin will be filled and hardened using the ultraviolet light, and you can see step by step you can make and feel that the shape of the teeth being returned. And once again the composite resin is being used to give shape to the teeth. Now the top most portion is the toughest one. We have to give a proper shape to the inner surface of the teeth, that is the medial surface, and also the superior surface, which is also called as the occlusal surface. If proper shape is not given to the occlusal surface, what happens? The upper and lower teeth may not come together, or there might be difficulty in getting a bite. So the biting surface has to be properly designed. Now you can see the superior surface is getting designed properly. We can put a crown, or there can be inlay or endo crown, or an inlay can be done with the metal also. Here that crowning is not done, the shape is given with the composite resin. The hazards of using only composite resin is it might break off when you try to bite any hard substances. So other than that, there won't be any disadvantage of this composite resin filling. And if a cap is used, definitely it gives a added advantage because you can bite hard substances and you can use the teeth as normal. And following this, a proper upper surface shape should be given to get a proper occlusal surface. Now after this, polishing has to be done because you have to give a proper shining to the teeth to match the adjoining teeth. So this is the procedure of root canal treatment. You can see initially how bad the teeth was, how decayed it was, and the after results. Definitely it gives a satisfied feeling for a dentist to get such a teeth. My rating for this filling is 10 out of 10.